Welcome to Creating Yourself podcast. I'm your host, Paige. This is an inspirational podcast where guests come on and share their real life stories. They discuss their struggles, hardships, and traumas. They also discuss how those encounters have helped them change, grow, and the healing process they've experienced. They share where they are today in hopes of helping someone else who could be going through the same or similar situations. So join me as we inspire others weekly to become the best versions of themselves. Hey y'all, welcome into another episode of Creating Yourself podcast with me, your host Paige. I am excited to have Whitney on today. She is going to be talking to us about her genetic disease that she suffers from and all the advocacy work she has done with that. So I'm excited to have her on. Hey, Whitney, how are you?
I'm good. Thanks for having me today.
Yeah, of course. Listen, I'm all ears on stuff like this. I love to bring awareness to different diseases. My son is a type 1 diabetic, so I'm a medical mom, as we like to call ourselves. So I'm anything that is in the medical world and I can bring awareness to, I'm all about it.
Oh, great. I think bringing awareness to like any disease or anything is great because I think with things like that, a lot of people aren't knowledgeable about it, especially because I have neurofibromatosis type 1, and it's actually the most common genetic disorder, but nobody's ever heard of it. People's heard about cystic fibrosis, but NF affects way more people than cystic fibrosis. So with neurofibromatosis, there's actually 3 different types. I have type 1, but there's type 1, there is schwannomatosis, and then there is NF2 related schwannomatosis, but I'll just talk about type 1. And it actually, there's about 4 million worldwide that have NF1, and it's in 1 in 2,000 births. And 50% of people that have NF1 have like a mutated, they inherit it from a parent because it's autosomal dominant. It means 50% of people, if your parent has it, you have a 50% chance of having it. But it also can occur spontaneously, so you don't have to have a family history. But it the NF1 gene, everyone has the NF1 gene, and it's on chromosome 17, and it's responsible for the production of neurofibromin, and that's a protein that prevents cells from growing too quickly. And since I have a mutation in my NF1 gene, I don't have that. My tumor suppressor is messed up, so that's why I can get tumors anywhere on my body, inside my body, whereas somebody that does not have a mutation, they don't really, get tumors, but I can get tumors throughout my entire body. Anywhere there's a nerve, it can grow. So it's also progressive and unpredictable. There's 4,000 mutations, so it can affect everyone differently. Like some people have it mildly. I consider mine mild, but some people have it more severe, more cognitive deficits or disfigurement, cancer. So it's like it's like the common predisposition cancer syndrome. So we're at higher risk for cancer and many other things.
So how did you find out that you had this diagnosis?
My dad had it. So when my parents were, wanting to have kids, I guess they knew it was a possibility. But I inherited it from my dad, but he passed away in 1999 from glioblastoma, which was likely due to the NF1 because you're at more risk for also bringing tumors.
Gotcha.
And so like with NF1, it can cause severe disfigurement, deformity, deafness, blindness, short stature, oversized head, ADHD, autism, but not everybody has all of those. It's just very but it's like, so the variation, which kind of make it, with studying it with researchers, because it's so varied, everybody has different experiences. So it's so like unique in that regard. And so it can also cause, because a lot of times people have more visible symptoms, but then other people have less visible manifestations. So, like, I don't think people can tell, but there's some people you can really tell because they have the tumors on their skin or they have the deformity. And so there's like hallmark symptoms that you can get diagnosed. Usually people are diagnosed as a child. But NF has records back to 1000 AD. So there's reports that it was around as far back as 1000 AD.
Oh, wow.
But it wasn't until the 1800s, like the 1880s, it was called something else. But then it was then called neurofibromatosis. And it wasn't until 1990 they discovered that chromosome 17 is kind of where NF1, they were able to pinpoint exactly where the NF1 gene, which is not the same as neurofibromatosis because everybody has the NF1 gene. Just people with the disorder have a mutation in that gene.
So, what are some things that you have actually dealt with your, with you having it? What are some things that you've suffered from?
So I'm lucky that it really doesn't affect my life, but I did have I had like a plexiform, and those are the ones that kind of can be disfiguring. It almost looked like on my arm an overgrowth of skin, just like hanging like off my body. And those plexiforms have an 8 to 15% chance of turning malignant in someone's lifetime. And they're really hard to remove because they wrap around your blood vessels, your nerves, so you can't really tell like what part. You can't remove it all. It's just impossible. And so I just hated how I looked. I felt ugly. I was wearing long sleeves in the summer. And so I really just got it removed for aesthetic purposes, but also because it could turn cancerous. And so I had that removed just because I wanted to. And then also, women with NF1 were 5 times more likely to get breast cancer than the general public. And then after age 50, it's still 3.5 times more likely. So the guidelines are age 30, get a mammogram and breast MRI. And I was getting my breast MRI, and there was like part of a tumor like right here that was found because the position that you lay in, because the breast MRI doesn't do your chest, it was just a little bit was there. And then we like got a CT scan and then a chest MRI, and there was discovered it was about the size of 2 golf balls. It was a superior mediastinal thoracic inlet mass. It was just like right up here, and I had no idea. So it was just found by accident. And they were able to remove it. It was just, I think it was an easy surgery. I was discharged like the next day, and I just had a drain for 2 weeks. So I couldn't like weightlifting, but I was like walking and going out. I didn't really have I didn't need any pain medication or anything. But I still have to be like with NF1. You have to be like, well, you should be not. I know a lot of people that don't, but it's kind of something that you should be monitored throughout your life. And I'm a proactive person, so even if I don't have any symptoms, I'm still getting my scans, my MRIs, because I just like to be proactive. And it's easier to fix a problem before a
Yeah.
smaller problem before it's a big problem. If that
Right.
it
Of
makes sense.
course. Yeah.
And because that surgery, I have to have 2 chest MRIs every year just to make sure that it hasn't grown back. And there's still stuff there, and they assume it's scar tissue, but they don't know for sure because they
Mhm.
did remove it all. But with tumors, they can grow back.
Yeah.
So they don't know if it's like some tumor that was macroscopic, but they're assuming it's they're assuming it's scar tissue because it hasn't changed from
Mhm.
scan to scan. So the only way to know 100% is to do another surgery. And since it hasn't changed, they're like, there's no point to, we're not going to put you through a surgery just because if it changed, maybe, but it hasn't
Yeah.
changed.
Right. Makes sense.
So there's just a lot of things to be proactive about. I think, at least that's my motto in life. I'd rather be proactive than reactive,
Mhm.
especially with something that has a bunch of unknowns. With like NF, it's something that's just unknown, um, like the future, like what's going to happen to you. So I think it's just better to stay on top of everything and to stay be educated about it.
Yeah.
And so with that, I never really talked about it before, um, because I was just kind of like almost embarrassed, ashamed, just I just never really maybe talked about it once a year when they had like NF Awareness Day, but I never really talked about it with anybody. I mentioned it a few times, but it was never anything that I made like out in the open, like constantly.
Mhm.
Not until like I had my surgery, and really because I'm the one that um, found out that you had to do the mammograms, breast MRIs, and just because of me being knowledgeable and I think it could have really helped probably my life expectancy because I mean, who knows how long it would have been in my body if I hadn't found it, or
Yeah.
because it was found to have the pathology said it was benign, but it had increased cellularity. So we don't know if like what would have happened, but so I started telling my story, like my surgery, and then educating people. And then one thing led to another, and I got really involved with advocacy because my surgery was in August 2023.
Mhm.
And so I did a lot of advocacy in 2024, and just kind of blew up from there.
Yeah.
Because I started the year going to Washington, D.C. About 90 of us went, and to advocate for increased federal funding. They've been going, the Neurofibromatosis Network has been going every year since 1996 to get federal money to help with research, um,
Mhm.
for NF. And also, it doesn't just help people with NF1 or NF, it can help everybody because NF is so closely tied to cancers. Other people can benefit from it, so not just the
Mhm.
people. So it can affect like the research that the NF research can help like 175 million people. They estimate just because of the close ties to cancers and other things. Um, but we went and advocated for $25 million, and it's part of, if I'm not mistaken, the DoD kind of the budget.
Mhm.
And a lot of advocacy groups are there for like different diseases or different things. And like I think breast cancer was the one that actually started that back in the 90s to advocate for money. And
Yeah.
then others followed suit. And in February. I think that's when they always go meet with our senators and our House of Representatives offices. And because it's a bipartisan bill, or not bill, but bipartisan, I'm not sure what the word, but bipartisan support. We get bipartisan support. We have people that sign off on it, that sponsor it. And so we go educate them, each of the
Gotcha.
offices. So I met with the Kentucky offices, and then, everybody, we try to go as many offices as we can. And so we go there and educate them, and then it goes through like the government processes,
Yeah.
and so they've been successful every year. Since 1996, they have secured over $400 million in federal research. And it can help, like I said, it benefits everybody, because it can be a model for cancer treatments, bone healing, nerve regulation, nerve regeneration, heart disease, memory loss, brain tumors, and it can help just everybody, not just people with. And so that was really exciting to go. That was the first thing I did in the advocacy work last year.
That's really cool that you got to go to DC and do stuff like that. I think that would be really fun to experience something like that.
It was really powerful and really empowering to
Yeah.
have a part in, raising awareness, because I know not everybody, because so many people, they can't be there in person. So we kind of we're kind of speaking for them too,
Yeah.
helping them, because, you have to take time off and travel. And so, as many people as we can get, it's always beneficial to go meet in person in office, especially not every state's represented, because I was the only one from Kentucky.
Oh wow.
So, we want to get everybody, because it's more, I think, meaningful if the constituent of the state is there, not maybe somebody else, because then they can see this affects the person in my state. And then, there's so many representatives and senators, and we have only like a day and a half to meet with them. So, and and then after, we still have things to do, even after we have the meetings, we
Yeah.
sign, we have emails to send out, we have so much things to do. So, to make sure that they sign it, or, make sure they allocate those funds to the research. And that was just a really cool start to the year. And I also was chosen as a patient engaged representative, because I work not only with the Neurofibromatosis Network for Advocacy, but the Children Tumors Foundation. It's a major organization that helps NF research. And as patient representative, I got to work on several projects with companies, biopharmaceutical companies, giving my input of the things they present to us, giving feedback of what we think about it. We can help. I help with that position. We can educate the NF community to work with researchers, help give the results to the community, review materials, guide research priorities, because sometimes researchers, or what they've been told doesn't match up with what the patient community wants. They think, because sometimes they don't know, and that's why sometimes it's important to hear from patients, because the medical community, they're they see the research, they see things, and they
Yeah.
sometimes might overlook things that are important, which leads me to, I got to talk to the FDA, which is probably one of my accomplishments I'm most proud of.
Yeah.
And so, with the FDA, it was a patient listening session, and not many It was actually pretty unique because it's really highly unusual for one disease to secure 2 listening sessions, because usually you only get like one, but
Mm-hmm.
this they were able to get they got one in 2019, and we just had one in May of last year. And there were 6 of us with NF1, including the caretakers. We talked specifically about cutaneous neurofibromas, or CNFs, and they're like the ones like on the skin, and they also could be disfiguring. And we all shared different perspectives about how they impact our lives, experiences of puberty, pregnancy, social stigma, and hopes for the future, because they affect over 95%. And, you know, them historically they've been considered cosmetic, but, it's not true, because it's kind of dismissive to everyone, because it can be disfiguring. Some people have like a dozen, some people might have hundreds or even thousands. And it's shown that it's detrimental to mental health, causes levels of distress, social stigma, diminished self worth and attractiveness, and as ostracization. And so the whole purpose of the listening session was to help them evolve in the drug approval process, understand the unmet need, and that how we would benefit from new drug treatments, and just informing the decision making, and help them understand why that's important to us in the community. And those kind of things just kind of help what bring change, and making impacts for others, those
Yeah.
kind of experiences.
Yeah, I think that's really cool, and I think it's important to bring the awareness to, you know, things like this, because when my son first got diagnosed with type 1 diabetes, there was so many people that just in my like immediate family that didn't even understand the concept of what it was. Like I didn't understand what it was, but then so many people confused it with type 2, and they're like, oh, he just has to take a shot here and there and this, and there's like, no, he like is insulin dependent. Like there were so many misconceptions versus type 1 and type 2 and how to take care of him. So it was like really I had to learn it in the hospital, like how to take care of him, and then come home and like teach my entire family how to take care of my child now, because it was like
Hmm.
it completely changes your entire life when you get that diagnosis.
I think so. Like, even like within the community, there's so much like misinformation or
Mm-hmm.
misunderstanding. Even like with people that also have NF1, I see so much misinformation. And then also, if you don't have it, there's always like misinformation about it, because
Mm-hmm.
there's 4,000 mutations that can affect people differently. So you look at somebody that's severely affected, then look at somebody that's not. There's so much variety. So people have misconceptions. They don't understand. Because I know a lot of times some people thought like I was autoimmune. I was like, it doesn't affect your immune system. I'm
Mm-hmm.
really healthy, and I take pride in the fact that I'm really healthy and I don't get
Yeah.
sick. So like some people, like especially during COVID, some people thought I was autoimmune, and I was like, no, I'm not going out because nothing is open.
Yeah.
There's
Yeah.
nothing.
Yeah.
Where am I going to go? Nothing's open. It's closed. So
Yeah.
that's like I'm fine. I don't get sick. So, but just you know, I think even like slowly educating people is important, but there's always going to be like misconceptions, and I think that's kind of also making just educating the community too, because I think a lot of times, or just people in general, are afraid to be
Mm-hmm.
advocates for themselves. And I think advocating for yourself is super important. Um, just even you're the doctor's office, and it's not saying that you disagree with them. It's just saying, hey, can we do this? And,
Mm-hmm.
and also like, I've never had the experience, but say they don't agree with you, you can try to find somebody that will
Yeah.
take you seriously. Because I know lots of people, they ask their doctor for kind of what is a reasonable request, and they kind of brush them off. And so you have to especially with something like this, like you know your body. So
Right.
teaching people to advocate for yourself because it's important. It's very important
Yeah.
to also just and that's why I try to use my voice too, to not only advocate for myself but advocate for others, because I know like some people don't have the opportunities to travel um, to different places to participate in, you know, these events. Because I also got to go to San Antonio. Every year, the Children's Tumor Foundation has a summit for like patients, doctors, caregivers, but they also have one for just like medical too.
Mm-hmm.
But I got to go to one because I worked with a pharmaceutical company on a project. So I got to go there and I got to go to the summit. And they have different like workshops, and you get to meet people that also have it or their children. And it's just important, I think, just to be involved in the community, sharing your story. Because, you know, even though it's just like you said, you know, I think, you know, type 1 diabetes is very common, you know, but you said, you know, your family and like people don't know about it, or like,
Mm-hmm.
you
Yeah.
know, kind of have confused it. And so I think with anything, I think we need to use our voice and kind of educate people, because there's people that don't know, they get it confused with something or misunderstand what it actually is. And so just trying to, I think, using my voice, since I'm privileged in a place where I can use my voice, because
Yeah.
I think that's what using your voice helps drive change. Um, because you know, staying silent, I know sometimes it can be uncomfortable to talk about personal things, um, you know, kind of oversharing things that you might not want to tell everybody. But um, it really does, I think, helps, especially in the rare disease space, because it can help lead to treatments, um, lead to more doctors being interested in doing clinical trials, because we now have more clinical trials for NF1 than ever. Um, and we also have, in 2020, there was a drug that treats plexiforms.
Mm-hmm.
It's an oral medication. So, because a lot of times the only um, treatment was just surgery, and that's not always possible. And you also can never remove all of it, but they have a drug now on the market that you take it orally, and it can reduce the size of um, a plexiform. And there's other similar drugs getting ready to be in the market that are similar to that drug. And they're also working on uh, topical cream for like the ones on your skin, and that's, I think, in phase 3 right now. So lots of things are happening, from where like they started a long time, like decades ago, to now,
Mm-hmm.
just by more people being interested in it, and more researchers wanting to develop a cure or better treatments to that.
Yeah.
And that's why I think they like, also the Children's Tumor Foundation does like campaigns like make NF visible. And they especially during May, because that's the awareness month, and that's when a lot of people you know, raise money, do fundraisers. They do them throughout the year too, but especially during May, educating people. And they also had like a big campaign that this, I think it was Lamar Advertising. They donated money to billboards across the United States, and there was actually, I can't remember how many were in Lexington, but there was one in Lexington, and it had like make NF visible, and it had just, there was 129 digital billboards in 31 cities across the country
Oh wow.
at the time that when I read their notice. There was 3 in Lexington, one in Georgetown. 1 in Shepherdsville, and 3 in Louisville. So there's 8 in Kentucky with the digital billboard that had like the make NF visible with the people standing there, to make sure that, I said it always increases. It's making NF research visible is important because it increases awareness. It attracts funding for research among researchers, fosters collaboration, and it also ultimately accelerates progress to effective treatments, by raising awareness, making it visible to people. And it also, speaking of the NF Awareness Month, that I also got a proclamation from the governor of Kentucky, Andy Beshear, for declaring May officially NF Awareness Month. So I got like the proclamation as well. And so I got that framed in my house. Just so I thought, also just trying to raise awareness any way I can, being involved. Because I think advocacy means using your voice, even if it's uncomfortable. And I think it's about action, sharing your insights, making sure your voice is heard.
Yeah, for sure.
Because I think so many times people, at least this is how I think about it, people think about your doctor as you versus them, like it's me against them, when really it should be like a partnership, like you're working together, you and your doctor, you're working together, or at least I think that's how it should be. And I think you can create a more supportive medical experience that way, and collaborative approach. I know not everybody experiences that, but I think that's how, I think that would be the goal for everyone, to have that relationship with their doctor, that they do feel heard, they're not dismissed, because sometimes, you need to find another doctor because whatever maybe you're going through might be time, can be the essence depending on your situation. So it's important to know if you just, I don't know, like you would have to find somebody else if you don't feel heard, because you deserve to get the care that you need. You deserve to get the care that you need if you don't feel heard. And that's why I always also educate the community about guidelines, because a lot of times people don't know about the guidelines, like about the breast cancer. We're supposed to start screening at age 30. So I think it's important to know those things, and not really expect somebody to tell you, because I found it myself, trying to research myself, and I found it that way.
Yeah.
And I think another way to advocate is participate in research, because I went to Chicago to participate in a biomarker study. And so what they were wanting to, a lot of institutions are working on biomarker studies. And so they're trying to develop a blood test where we can get a blood test and we can see just from the blood test if tumors are present or if there's cancerous tumors. Because the only way now is like through MRIs, probably CTs, biopsies, things like that. And so the hope is and I did the one in Chicago, which required a blood draw and a full body MRI. And I really wanted the information from a full body MRI, because sometimes it's hard to get in a one patient, because a lot of doctors think we only scan unless there's an issue. But I don't believe in that. And so it was just an easy way for me to help science and also get what I wanted to. And so I went to Lurie's Children's Hospital in Chicago, and they've established a method using blood plasma from mice with NF1 to identify biomarkers that might signal the presence of tumors. So they're going to use like the blood tests from all the subjects and then like the results of the MRI and somehow see if there's something in our blood that dictates tumors or whatever they do. But there's also many other biomarker studies that have lots of hope for the future. So there'll be less invasive tests, hopefully, that you can just do a blood test every so often, and then then you can go from there. If you have presence of one, then you can go to the MRI. But it seems very promising where the research is headed. I think kind of exciting to see how far we've came in that field with better treatments and hopefully better detection as well.
Yeah. It sounds like you've done a lot of research on your own, and you've really looked into it and done your advocacy work for yourself. So
I think so. I mean, before I didn't really think about it as much because I was younger. I didn't really think about it as much. But as I got older, I realized, it's very important. And just like I said before, I'm a very proactive person. I'm not going to sit around and wait for something to be a problem.
Yeah.
So I want to like stay 2 steps ahead, if all possible, of everything. 2 steps ahead, just like, I had the full body MRI. I didn't do my brain. But I did get a brain MRI after because I wanted the full picture of, and because the MRI, I discovered that I had about 7 plexiforms inside my body. And those are the ones that can turn cancerous. And then I had like 6 other types of tumors. And then I have like a brain lesion. So just from the MRIs. So now like I have a baseline, and I didn't know they were there because I knew my arm was there because I had surgery to remove part of it. But the other ones are so small, and I never knew they were there. But now that I know they're there, I can always get them monitored and have a baseline. So if like I start getting pain in that area, I can get it checked out more. Or, when I go for my next MRI, this is what it was in this year. So I have like a starting point so I can know if they've grown.
Yeah.
And so I just think, and I told a lot of other people in the NF1 about the same study in Chicago, because a lot of people want an MRI. They think it's very important to have a full body MRI because we deserve to know what's going on in our body. And research tells us that if you have like one plexiform, you have more. Just you don't know where they are, or that. And so I told several other people, and they actually participated in the study too. So I told like I think 3 or 4 people, and they all went to Chicago as well and did the same study.
Nice.
And so now they have that information to help them monitor whatever the findings were for them. They were able to find, and we also help science, hopefully, as well, giving that information to the researchers as well.
Yeah, well, it sounds like you're doing a lot of really awesome work for yourself and for others and advocating. So I think that's really cool. So I really appreciate you coming on and talking about your story and your advocacy work and everything that you've done. And I think, you're doing really great work for yourself and for others and taking care of your health. And I think that's the most important thing we can do for ourselves is definitely take care of our health, because we only have one life. So I think it's super important. And the education work that you're doing is super important because I've never heard of it. I didn't know what it was. And I probably would have never heard about it until you came on and talked about it. So I think it's great that you're out there and you're talking about it and you're educating people on it too.
Thanks so much. I know you brought up a great point that, we only have one life, and it's important we take care of ourselves because we have our health until we
Mm-hmm.
don't. We have our health until something happens. So I think it's always important to, really take it seriously,
Mm-hmm.
just because you never know what might happen. And so I just really wanted to just something change, like after my surgery, just wanted to embrace being an advocate, turning my experience into opportunities to educate others, raise awareness, knowledge, and hopefully empower patients, even if you don't have an F1. And I've had people message me, and they don't have it. They just kind of felt empowered to talk to their doctor about certain tests because they were at
Mm-hmm.
risk for, and just like, I just want also to help people kind of, kind of ask them to, or encourage them to contribute to projects and research, because
Mm-hmm.
staying silent, I mean, you can do what you want. We have free will, but if we
Yeah.
speak up, get involved, we can actually help science, we can help the research, we can help the others, we can help future generations, because it is the most common genetic disorder there is, but you know, the average person has never even heard of it.
Yeah.
So we have
Yeah.
a lot of work to do.
Yeah, no, I had never heard of it until you brought it up or until I got in contact with you. So it's definitely something that I think you're doing great work. And I really appreciate you coming on and talking with us today about it and educating my audience on it. So I appreciate that.
Thanks so much. Thanks for having me.
Yeah, of course. We will definitely put information about it in the bio. I'll get some information from you, some websites, and we'll put everything in the bio and make sure that we definitely have where people can go look for more info if they need it about it too.
Okay, great. Thanks so much.
Thank you all so much for tuning in to this week's episode. Make sure you hit the follow button on whatever listening platform you are using, and head over to my social media pages and give me a follow there as well. You can find me on Facebook, Instagram, and now TikTok at Creating Yourself Pod. And if you have a story you would like to share on this podcast, email me at creatingyourselfpod@gmail.com, or you can message me on any of my social media pages. Make sure and come back next Tuesday for a brand new episode. Hope you guys have a great week. Bye.